Pediatric groups have declared the crisis a national emergency as challenges presented in the pandemic agitate this growing problem. Tonight, we are hearing from local medical experts about what they're seeing in our city, plus how attention to behavior can stop kids in need from falling through the cracks. Research from the Centers for Disease Control and Prevention found that emergency visits related to mental health increased by 24% for ages 5 to 11 and 31% for ages 12 to 17 years old. Our Gabrielle Harmon is talking to the experts at Norton and U of L Health about the warning signs you need to look out for.
Health experts are now declaring a national emergency when it comes to kids and their mental health. Local health experts say the pandemic has taken a bigger toll on kids than you may think.
Yes, children are resilient, but it is really important to check in with your kids.
With the increase in isolation, fear, and grief, the CDC has reported an increase in emergency room visits for mental health emergencies in kids ages 5 to 17 in the last year.
A lot of the reasoning behind it that we're seeing is the repercussion of the isolation of NTI, which, we made the best of a bad situation, but there's a lack of socialization. You're kind of stuck at home on a computer, lack of social outlets.
Laura Hellman is a mental health therapist at Peace Hospital's Children's Peace Center. She says signs parents should look out for are irritability, isolation, lack of interest, and acting out.
I know that if we look at national trends, we are seeing certainly an increased risk or increased rates of emergency department visits for suicidal ideation and suicidal behavior.
At the beginning of this year, the CDC saw a 51% increase in suicide attempts for girls ages 12 to 17. Dr. Kathy Hopkins with Norton Children's says it's been a tough time, but hopefully in the near future, it will get better.
Kids have been having a hard time. I think it's starting to get better as we all start to move towards, as vaccination rates go up, and so we can, and especially as more adolescents get vaccinated, and hopefully children here soon, that allows them to return to those activities that are super essential for healthy development.
In Louisville, Gabrielle Harmon, WHAS 11 on your side.